Let's discuss dengue fever. Dengue fever is a vector-borne disease. Its epidemics are common in Pakistan and India. It's fatal in children. It's causing a lot of deaths in children. So we will discuss this session according to following learning objectives. First, we will discuss the epidemiology of dengue fever, where it is common, why it is common, who is getting the disease, what is triad of dengue fever. Then we will discuss various clinical features of dengue fever. Then, what is management of dengue fever? As dengue is a preventable disease, there is no vaccine available. And in the end, we will summarize the session. So let's start with epidemiology of dengue. Dengue is a vector-borne disease, mosquito-borne disease, and then virus causes the disease in human. This dengue fever is a self-limiting disease in majority of cases, but in some cases it may lead to dengue hemorrhagic fever and dengue shock syndrome if remains undiagnosed or untreated. This is the vector of dengue fever. Vector is Aedes aegypti and Aedes albopictus. Both of them cause dengue fever. Dengue can kill, so we have to diagnose it early. We have to treat it early to prevent the complications. And dengue is transmitted through female mosquito, Aedes aegypti, and this mosquito is daytime feeder. It feeds on at daytime, so it bites at daytime, as compared with malaria, which malaria vector which bites at night time. Lives around human population. It lays eggs, and its eggs are extremely resistant. They can remain dormant for months. Only female mosquito bites, and a mosquito becomes infective after 7 days. So this mosquito remains infected for lifetime, but life ranges from 15 to 65 days. Mosquito can lay egg for 3 times in life. So lifetime is 15 to 65 days. It lays eggs 3 times in its lifetime and lays about 100 eggs each time. So it lays total 300 eggs. 300 eggs are produced by female Aedes aegypti mosquito. They can remain dormant in conditions up till 9 months, after which they hatch when they get favorable environment. There are approximately 500,000 cases of dengue hemorrhagic fever every year which need hospitalization, and they are common in children. And at least 2.5% of cases die because they don't get proper treatment. So proper management is mandatory. There is urbanization. People are migrating. People are migrating to cities, as in Pakistan. There is urbanization. So urbanization brings urban slums. There are problems of sanitation. There are problems of living. There are problems of living standard. So they live in areas which favor mosquito breeding. They are increasing mosquito breeding places. Household water storage is common. There is no solid waste disposal services. So breeding places are increasing and the disease is increasing. Burden is increases. How it is transmitted? Mosquito becomes infected after feeding a patient from daytime. Okay, it becomes infected on fifth day, and it can survive in a temperature of 16 to 30 degrees Celsius. It requires humidity, 60 to 80% humidity, so it is common in humid conditions. It breeds in containers that are present around the houses. These are the containers. These are the breeding places of dengue mosquito. These are the breeding places. Tree holes. You can see vehicle tires. They are the commonest. Vehicle tires. Mosquito grows. They provide breeding places. When mosquito breeds, it bites and transfers the disease to human beings. Humans are the reservoir. Transmission cycle is man mosquito and then man. All ages are susceptible. Both sexes are susceptible. Clinical feature may be from mild to severe, but children are more susceptible to get dengue hemorrhagic fever. When dengue hemorrhagic fever outbreak is common, there are more deaths, there is more mortality. So we need to control hemorrhage. What is the environment? Tropical, subtropical, peri-urban slums. It may be common in rural areas because there is uncontrolled and unplanned urbanization. People are migrating to cities without any planning. There is transportation, there is human migration. People are using plastics, solid, there is no solid waste disposal. There is poor water storage and management due to lack of planning. Dengue has a seasonal pattern. It is common post monsoon season. This is the epidemiological triad. Agent is dengue virus, flavivirus. Host human beings. What is the environment? Urban slums. It grows in tires, plants. What are the vectors? Aedes aegypti and Aedes albopictus. This is transmission cycle of dengue. When mosquito feeds, it acquires the virus. Then it bites a human being and transfers the disease to other human beings. It forms a chain. It forms propagation. So total cycle is completed within 28 days. 28 days are required to complete the cycle. So this is man, mosquito, and man cycle. What are the symptoms of dengue fever? You must remember fever. It causes high grade fever, eye pain in retroorbital area, retroorbital pain is common. It causes headache. It can cause muscular pain. It can cause bone pain. Nausea, vomiting may be common. There is joint pain. It may cause maculopapular rash. Rash may be common in case of dengue fever. This is rash of dengue, maculopapular rash. Maculopapular rash. It may cause bleeding from gums because platelets, number of platelet count reduces in dengue fever. So bleeding starts. These are other symptoms. Redness of throat, pain in bones. There may be vomiting. There may be redness of eyes. Rash, as I already mentioned. Pulse is rapid. There is dizziness. It can cause insomnia also. If a person suffering from dengue is unable to sleep because he has body pains, body aches, high grade fever, retroorbital pain. And this is viremia cycle. Dengue fever can range from asymptomatic disease to severe symptoms. Majority of cases, it is asymptomatic. It is self-limiting, especially in adults, those whose immunity is better. But it can cause symptoms in immunocompromised people, in children, in older people. It is fatal. If it is symptomatic, it ranges from undifferentiated fever, like it can cause fever, tachycardia, body pain, flu-like symptoms, and it can also cause dengue fever or classical dengue fever. Classical dengue fever is recognized by high-grade fever, photophobia, muscular pain, plus retroorbital pain is diagnostic sign of classical dengue fever. It is asked in university question that a person suffering from high-grade fever, tachycardia, retroorbital pain with rash, this is classical dengue fever. So you have to remember retroorbital pain. Retroorbital pain. Symptomatic dengue fever can be without hemorrhage or with hemorrhage. Number of platelet count decreases, hematocrit increases, which can cause bleeding, which can cause hemorrhage. So it can be without hemorrhage or with hemorrhage. If platelet decrease to 10,000, it may cause bleeding from nose and bleeding from gums. That is dengue hemorrhagic fever. And dengue hemorrhagic fever may lead to dengue shock syndrome. If we control the hemorrhage, there is no shock. But if hemorrhage proceeds, there is dengue shock syndrome. So, dengue fever can cause hemorrhage. Dengue hemorrhagic fever can cause dengue shock syndrome if remains uncontrolled, untreated. Management at earlier stage is important to reduce the dengue shock syndrome, to reduce the mortality. You can see asymptomatic, symptomatic. Symptomatic can be undifferentiated, dengue fever, hemorrhagic fever, and shock syndrome. Dengue hemorrhagic fever can be classified into 4 grades. If a person has fever and positive tourniquet test, this is grade 1 dengue hemorrhagic fever. If person has fever, positive tourniquet test, and spontaneous bleeding, That is grade 2. Bleeding starts cause of reduced platelet count. If there is circulatory failure, marrow pressure decreases, there is hypotension and cold skin. Cold skin and restlessness can cause shock. So fever continues, there is tourniquet test, there is bleeding. Bleeding causes shock, it causes hypotension, cold calms skin. And if it is profound shock, blood pressure reduces, it becomes undetectable. Patient blood pressure falls to zero, pulse falls to zero. That is grade 4, that is severe form of dengue hemorrhagic fever. It leads to shock, and shock can lead to mortality or death. So there are 4 grades of dengue hemorrhagic fever. It starts from fever, then it can cause bleeding. Then pulse becomes weak. With weakening pulse, blood pressure becomes zero. Dengue hemorrhagic fever, what must be present? There should be history of fever from 2 to 7 days. There should be hemorrhagic tendencies. How? Positive tourniquet test. There should be petechiae. Bleeding from mucosa. There can be bleeding from GIT tract. There are injection sites. There can be melena and hematemesis. And platelet reduce, platelet count decreases. So we can say that there is dengue hemorrhagic fever. What is other criteria? There is plasma leakage. Plasma leakage is very important. Hematocrit rises up to 20%. Plus, you have to remember when there is plasma leakage, there is pleural effusion, ascites, hypoproteinemia. We can detect pleural effusion and ascites. We can detect pleural effusion by chest X-ray. We can detect ascites by performing ultrasound. So there is a continuous process. There is a gradual process of shifting from dengue fever to dengue shock syndrome. So we need to monitor these cases. All other criteria like fever, bleeding, gums, hematocrit, plus narrow pulse, weak pulse, and hypotension. That is very important in dengue shock syndrome. Skin becomes cold, person becomes restless. He's going in shock. We need to manage. We need emergency measures. Why we classify different forms of dengue fever? For interventions, for management, to control the problem, to save the life of person. What are laboratory findings? Clinical signs are important. Plus, we can isolate the dengue virus from serum. There can be PCR. We can see CSF, detection of antibodies, IgM and IgG antibodies. There are serological tests. There is isolation of virus. We can perform cerebrospinal fluid test and PCR. What are danger signs? We need to know the danger signs. Bleeding is the first danger sign. From where? Red spots, petechiae are formed, then they cause bleeding. Bleeding from gums, vomiting with blood, black red stools, heavy vaginal bleeding. There can be frequent vomiting. There is abdominal pain. Vomiting, bleeding, abdominal pain may lead to shock. There is drowsiness. When there is vomiting, there is bleeding, blood pressure reduces, and person become drowsy or irritable. Then he may become pale, skin become cold. There is difficulty in breathing. All these 6 signs, bleeding, vomiting, abdominal pain, drowsiness, low pulse, feeble pulse, and difficulty in breathing. These are the danger signs of dengue infection. These may be asked in university. What are danger signs of dengue? So you must remember these signs. We can grade it. Dengue fever, only fever. There is headache and there is retroorbital pain. This is diagnostic sign of dengue fever, myalgia, arthralgia. Leukopenia, definitely if you perform CBC, platelet count is reduced in dengue fever. We need to monitor platelet count. Dengue hemorrhagic fever grade 1, all above signs plus positive tourniquet test. Tourniquet test must be positive. In grade 2, there is spontaneous bleeding. Bleeding starts after reduction in platelet count. Then in 3, circulatory failure starts. Then shock starts. Platelet count is reducing and hematocrit is increasing. This may be a university question or MCQ. We can confirm it by PCR. We can do virus culture. Culture is the most important test. We can do antibody test to detect dengue virus. Dengue is a preventable disease and no drug or vaccine is available. There are trials. Trials are going on for vaccination, but they are not successful until then. Vector control is most important method. So we need to control the vector of dengue. We need to control mosquito breeding places. We need to control Aedes aegypti. There should be early detection. Early detection is most important. Surveillance is also important. Why surveillance? Because we need to monitor situation of dengue. It is endemic, but it can lead to epidemics. If number of cases are rising, we need environmental surveillance. We need surveillance and screening to monitor the situation. They are rising or not. Then we can do control measures. There is epidemiological surveillance. Number of breeding places of mosquito increasing. Entomological surveillance. They show the breeding places. They show the number of cases. Distribution of disease. Epidemiological surveillance shows distribution of disease. At what time, who is getting the disease, where disease is common. Entomological surveillance shows vectors, mosquito breeding places. Then we need to perform laboratory tests in susceptible individuals or in high risk individuals or people who are living in high risk areas. We need to perform screening tests. We need to isolate dengue. Early reporting. If a case comes from a certain area, we need to report this case. We need to notify to authorities that cases of dengue are coming. Then they can take preventive measures or control measures. Treatment is basically symptomatic or sportive. There is no specific treatment for dengue fever. And remember, bed rest. We can give paracetamol, sponging, but aspirin is contraindicated. In dengue fever, cause it can cause bleeding. Aspirin itself can cause bleeding. So remember bed rest, antipyretic. We can give paracetamol. We can give fluids. There is no role of antibodies and platelet transfusion. Remember this, we need to control the root cause. We need to manage the cause. So we can give IV fluids. Why IV fluids? To stop dehydration, to improve hydration. In case of shock, we need to give oxygen therapy also. Blood transfusion in case of severe hemorrhage. We can give blood. Fresh frozen plasma can be given, but in case of severe hemorrhage, if there is bleeding from nose and gums, bleeding continues, we can give blood, fresh frozen plasma. But most important measures are vector control measures. How to control measures? That's important. Mosquito repellents, creams, liquids, coils, mats. We should advise people who are living in endemic or epidemic area that they should wear full sleeves and they should not sleep outdoors. Use of bed nets, mosquito nets, especially for infants and young children, because they sleep during daytime in monsoon season. Nets are required. There are myths that nets are required at night time. No. In case of dengue, nets are required at daytime because this mosquito bites at daytime. You must remember this. You have to advise the people. What is biological control? Larvicides. Then there is chemical control. Then there is pyrimethamine spray. We can do spraying. We can clean the containers. What is environmental management? We need to detect and eliminate mosquito breeding sources. We need to detect the source. We need management of rooftops, proper covering of water. Water must be covered. There should be reliable water supply. And we need to monitor the situation. We need to monitor mosquito breeding places. We need to monitor the situation weekly or day by day. It depends on epidemics. It depends on current scenario that whether we need to monitor it weekly or on days. Because in case of epidemic, we need to monitor it regularly. Then health education has the most important role in controlling dengue fever. We need to educate. We need to educate at various level, at household level, at family level, at community level, and at institutional level. We need to educate people. We need to educate community. We need to educate at institution level, like in universities, colleges, schools. Schools are most important. Question is, what we need to educate? How can we educate? We need to tell them regarding dengue fever. We need to tell them regarding full sleeves. We need to educate them regarding bed nets, mosquito nets, repellents, coils. We need to tell them that they should sleep indoor. especially in monsoon season or in post monsoon season or in season where dengue is common. We need to educate them if they feel fever during epidemic of dengue fever or headache or retroorbital headache. They must consult hospital. They must consult doctor cause the disease can progress and cause shock. So immediate hospitalization is important. Our immediate consultation is important. So we need to educate them regarding vector control measures, regarding treatment measures. We must tell them that they should not take aspirin. It is contraindicated. We must tell them that they should take fluids. They should take oral fluids. They can improve their hydration status. And now we'll summarize. We need to remember epidemiology of dengue fever. What is distribution? Distribution according to time, place, and person. Which time? Time is important to implement control measures post monsoon season. What are the vectors? This is Aedes aegypti and Aedes albopictus. Dengue fever, remember, is a viral infection. You can protect yourself. How? You can keep your environment clean. Protective clothing. There are repellents available. Place screening on windows. That's very important. Cover water containers. So you can apply these measures. And you must know regarding signs and symptoms. You must educate your community regarding signs and symptoms like fever, vomiting, headache, myalgia, bone pain. There may be pain in eyes, weakness. You must know these signs and symptoms. You have to educate your community. So you have to tell about headache, pain behind eyes. It can cause nausea, vomiting, glands may be swollen, joint pain, rash. And you must educate regarding warning signs. Severe abdominal pain, then bleeding, vomiting, rapid breathing. Breathing rate may increase. There is fatigue, there is restlessness. These are guidelines of World Health Organization. So how can we treat this? You should start taking rest. ORS is very important. Why? Because there is electrolyte imbalance in case of fever, high grade fever. So you need to tell people regarding ORS. You can take fruit juice, rice, water, plenty of fluids. You can just take paracetamol. Remember, aspirin is contraindicated. Then you must consult your family doctor if the symptoms increase or if the duration of fever increases. In some cases, it is self limiting, but it may progress. So you should educate your community regarding the symptoms, regarding the warning signs, regarding the treatment. Plus, it can cause undifferentiated fever. There are flu-like symptoms. It can cause symptomatic fever or classical dengue fever. Classical dengue fever, there is high-grade fever, retroorbital pain, myalgia. Then classical dengue fever may lead to dengue hemorrhagic fever. Tonic test is positive. There can be bleeding from nose, bleeding from gums. There can be melena and number of platelets. Remember this, platelet reduce. And hemorrhagic fever can lead to dengue shock syndrome. So there is a common university question that a person working in garden, working environment is very important. That's high grade fever, retroorbital pain. There is thrombocytopenia. There is rash. What is your diagnosis? So from retroorbital pain, you can diagnose dengue fever. Cause rash can be present in other diseases, but thrombocytopenia and retroorbital pain and fever are classical triad of dengue fever. If they ask, a person has abdominal pain, person has pleural effusion, ascites, and hematocriteritis, then there is dengue hemorrhagic fever. So you can diagnose dengue fever on the basis of fever, retroorbital pain, and thrombocytopenia. Then, most commonly asked question, how can we manage dengue fever? Remember, You can manage dengue fever by symptomatic management, symptomatic treatment, fluids, and by vector control. You can control the vector, you can control the disease. You should boost the immunity, and it is most fatal in children. Dengue hemorrhagic fever causes deaths in children. Almost 2.5% children die because dengue is a disease of developing countries. Developing countries have lesser facilities. Their health system is fragile. They have low standards of living. Majority people are living in urban slums. There is migration, so it is common disease there, and most of the cases are not diagnosed properly. Most of the cases are not treated properly. So the disease progress to hemorrhage and shock and can cause mortality. So best way to control dengue fever is to do preventive measures, is vector control, and that can be achieved by health education. We need to educate our community regarding dengue fever, regarding symptoms of dengue fever, regarding hygiene, regarding sanitation, so we can reduce the burden of disease. Aim is to reduce the burden of disease. Aim is to reduce mortality. Aim is to reduce morbidity. We know the season that it is common in post monsoon season, so we need interventions in post monsoon season. We need to control epidemics. There is collaboration is required, community participation is required, health authorities participation is required, then health education is major tool. We need to tell our people how to control, how to maintain hygiene. So this is a collaborative effort. Government is trying, but there are few resources. Plus, the major problem with developing world is lack of health education, is lack of preventive measures. Main focus is on treatment measures. Hospital, they just diagnose and treat. There is no surveillance. There is no monitoring. Research is not common in such scenarios. So we need to plan, we need to implement, we need to monitor. Environmental surveillance is required from where cases are coming.